All right. Thanks everybody for being here. I'm glad to see you. Hope y'all had a great Christmas and New Year's. Glad y'all are back with us. I want to go ahead and open the floor to you all for any announcements, anything you want to share, anything you've got going on, whatever you want to let the full group know about. Go ahead and share now.
Hello, my name is Ashley Arnold with Tennessee Voices Survivor Connection Program, and we work with victims of crime and their families for about a period of 90 days. It's completely free. We're grant funded, but if they have TennCare, Blue Care, whatever, we can bill for that service. We provide psychoeducation and referrals and resources for clients. So my information is in the chat. If you know someone who may benefit from this service, please let me know and I can walk you through the referral process. Thank you.
This is Gabby Smith with the Tennessee Commission on Children and Youth. If you don't know about TCCY, it's a small state agency that does child advocacy for kids in the state of Tennessee. So I cover upper 8 counties and I run a regional council. We do mostly, we provide some good education about topics regarding children and youth. But in February, we'll be having our first quarterly council meeting. And this is just for anybody who works in the world of children and youth, and want to learn about kind of what's going on with kids in our region, what services are available, what grant funding is available through TCCY, what legislative updates there are, anything like that. So if you're interested in coming to that meeting, you don't have to be a council member. It's open for anybody who's interested, but I will put my email, my email is in the chat. Feel free to shoot me an email and I'll make sure you get that invitation. But that's February 7th from 10 to 11:30 at the Summit Leadership in Johnson City, the glass building off the Bristol Highway.
Hi, everyone. This is Layla Wright, and this is my first time on this meeting. Thanks for having me. And I do Healing Intentions AcuDetox. It's a ear acupuncture that's used for drug and alcohol detox, as well as helps with PTSD and other traumas. And right now I'm doing a community group on Wednesdays. It's on a sliding scale. So on Wednesdays at 3 in Elizabethton at Essence Day Spa. And also I'm looking for other opportunities to come and do community groups. If anyone would like additional information, I have a flyer and a website you can read more about. Thank you.
Hey, this is Chelsea from Project Access. Just kind of reminding everybody that we're in the last 2 weeks of open enrollment for the health insurance marketplace. So we're going to be having some weekend hours this upcoming Saturday from 9 to 1, and then next weekend on Saturday from 9 to 1, and Sunday from 11 to 3. So if you all have any clients or patients that need assistance with health insurance marketplace, we'll be more than happy to help them throughout the week and on those weekend hours when we're usually not open.
Hey, this is John Knack with Creekside. We're having a ribbon cutting on January 19th to open up 24 more beds, which will give us 96 inpatient beds. That services kids, detox, adults, and gerio. We're also going to have some light refreshments and an open house. So if anybody's interested, it's January 19th at noon. I'll put some information in the box if you have any questions. Thank you.
All right. Anybody else have anything they want to share before we move on?
Hey, Julian.
Hey, Tyler.
Hey, so I wanted to go ahead and plug in that just as a reminder, we're going to be having 4 in-person meetings in 2024 for the Carter County Collaborative Group. These are going to be a little bit different than our normal virtual meetings. This is going to be kind of more action-based meetings through our subcommittee groups. If that's something that you're interested in, we'll be having a lunch. That first meeting that's going to be in person is going to be March 14th from 12 to 1:30 at the Carter County Health Department. I will send out a meeting reminder, much like I do with these. So just be on the lookout for that 2 weeks prior to that meeting. Don't get it confused with the virtual meeting that we'll have the week before that. So we will still have the virtual one. Then that next week we'll have an in-person one. Just wanted to remind everybody.
Thank you, Tyler. All right, y'all. Last call for fun activities or introductions or anything you want to share.
I just wanted to ask when the other 4 or the other 3 in-person meetings will be, just so I can go ahead and get them on the calendar.
Yeah. So that first one's going to be March 14th. And then the next one is going to be June 13th. The third one will be September 12th. And then that fourth one will be December 12th. And the times for all those will be 12 to 1:30 at the Carter County Health Department.
Thank you.
All right, y'all. So we will go ahead and move into our speaker portion of the meeting. Today we have Caroline Cheneth and Shauna Johnson with Carter County Health Department. So we'll go ahead and turn it over to them.
Thank you, Julian. Can you hear me okay?
Yes, ma'am.
All right, great. Thank you so much for letting us speak today. I'm going to put in the chat box the brochure for the Carter County Health Department. Please feel free to take a look at that and to use it however you wish. And I think Shauna is sharing up just a really simple flyer of all of the different services that we provide. But I just wanted to, kind of take a little bit of an elevated look at public health. It is about protecting the health of the public at large. It's about promoting their better health, and it's about improving health where we can with different safety net services and different outreach services that we conduct. In just a very broad capacity, we provide a lot of services that folks may not be aware of. It is a lot of the services are things that everybody can take advantage of, and they may not be as quickly thought of as other public health services. We provide birth and death certificates for everyone in the community. We do, of course, primary care services, which is acute services. We do some chronic management of things like asthma and diabetes. And this would be for uninsured folks. And it's designed to be a safety net until they can get into a medical home, until they can be routed to a medical home. But of course, we do have some patients that, are having trouble with that. And, so we do end up having some folks, particularly with chronic conditions, that we manage for quite some time. We do family planning services, and this includes just general men's reproductive health, women's reproductive health, contraception, of course. The health departments do provide contraception services that prevent pregnancies from establishing in the first place. So we don't provide any contraceptive services that would harm or impact in any way an established pregnancy. We do provide sexually transmitted infection screening, testing, and counseling. We provide pregnancy testing, of course. We provide the WIC program, which is our nutritional supplemental program for pregnant women, new moms, children up to age 5 who have qualifying issues, and those can be a broad number of issues. That's not just medical issues, that would be socioeconomic issues, just a wide variety of different considerations for that. Of course, we look at different communicable disease services like COVID. So we did that for quite a little while, and that's about all that we did. And I do want to say, pardon me if I have to cough and wheeze. I, like the rest of the free world, have gotten that amalgam of respiratory crud, various types of respiratory crud. So I really apologize if I have to step back and punt and cough a little bit and wheeze and sneeze. So we do have a breast and cervical cancer screening program for eligible women to help get their screenings done regularly and on time and early enough to be very helpful in protecting their health. We provide prenatal services that involve things like pregnancy screenings. And then at that time, we help get TennCare insurance set up, presumptive insurance set up. Again, we look at eligibility for the WIC nutritional program at that time. We also have a tobacco cessation program for pregnant women that and their home partners, their partners in the home and family members in the home. We have gotten good feedback over many years that with this incentive-based program that helps with the cost of diapers and the cost of other pregnancy and new baby related expenses, there's been a really good response and a great body of evidence that this is helping women who are smoking and pregnant to stop smoking. And we know that that creates better health outcomes for the baby and, a better future for the baby, even down to the secondhand smoke in the home. We do provide general environmental health services. This is a little bit of a cousin to the Department of Health. It is within the Department of Health, but it's a little bit different division than the local health department. But we do house an environmentalist, and that is our person who looks at restaurant safety so that we're all, safe when we go out and eat out. It includes like tattoo parlors, swimming pools, public swimming pools to make sure that they're being kept up to code. Childcare facilities are reviewed by our environmentalist, bed and breakfast facilities, campsites, festivals that have food and food trucks and things of that nature. So they do a very broad variety of services that touch us and protect us all. Dental services, we do have dental services that are comprehensive services available for uninsured children and adults. At this time, all across the state of Tennessee, we've got a tremendous shortage of public health dentists. In the region, we are down to, I believe, just 2 dentists that cover various counties. So one of our dentists is based here in Carter County. We do have Dr. Vines here. Essentially 3.5 days of the week, and 1 day a week she does cover the Johnson County Health Department. So we're a little better off than most, unfortunately, but it still is not enough to scratch the surface. So we do provide those services to uninsured children and adults. The way that we provide dental appointments is on the 15th of the month. We open up our telephones, and it's kind of a first call, first serve system. And our appointments do fill up very, very quickly on those mornings. So we fill up for the services for the coming month. And that allows us to utilize as many appointment spots as are available, given the number of dental hands that we have available to do the work. We do have a CHANT program, which stands for Community Health Access and Navigation in Tennessee. That is a home-based and a case management-based program. Our social counselors are extremely helpful with in assessing families based on their need, and then matching them up and pairing them up and connecting them to resources in the community that they may need. And these are resources of all kinds, resources for the home, medical resources, food insecurity issues are addressed. So it's just a real broad wealth of information and education that they can provide to young families, new families, and families that would otherwise be at risk for maybe not having access to all of the different things they need for a good, healthy family unit. And then we also have ancillary programs out in the community. And I'm so glad that Shauna, my health educator here, joined me today, because her work is tireless, and it takes place across the community with a variety of different partners. She provides education across age sectors, across need sectors, and the health educators are really a very important part of our face to the community. So I really appreciate her being here with us, and she's going to talk a little bit more about the health education services that she provides. I do want to point out one area of concern. So we've covered the things that have to do with access to public health and participation in public health, and I'll be glad to take questions and do my best to provide you answers in just a moment. But I do want to cover one area of concern, well, a couple of areas of concern actually. We are working on really beefing up our ability to help provide access, to reduce barriers to access to our services, and to increase participation of the public in public health services that protect our whole community. And so I'm talking primarily about things like vaccines for flu, pneumonia vaccines where that's appropriate, vaccines for COVID, childhood vaccines that are needed to protect our little ones at school and as they, become out and about and social, adult vaccines that are needed and are protective for us all, vaccines that help us go home to maybe elderly family members or family members who are immunocompromised for whatever reason, to help protect them. So we're really doing a lot of work with our partners, and we've got the greatest partners in Carter County. I think the Carter County Collaborative is an example of that. We've got great partners in the community. So we're doing an awful lot of bringing our nurses and our clerical staff and our administrative staff into the and onto the sites of our partners to do those different vaccines. We're doing fluoride varnish applications, which in and of themselves are just protective. But again, we know that access to dental care is at a premium, and it's not as broad as it should be, of course. So fluoride varnish applications are a great way to protect teeth, and that is for children and adults. So we're doing those services out in the community. We're also taking services out in the community that we can do as far as various screenings for healthcare services, various pregnancy, health and reproductive health services that we can do in the community. And then, of course, our regional office always goes to our schools in a round robin fashion, and they do the in-school oral health screenings, and they too do fluoride applications there. So we are really beefing up our ability and our availability to come and interface with different partners. So if your organization, if your agency, if your group that you are involved with, particularly if you deal with vulnerable populations, or those who often don't have the same kind of access that others may have to healthcare services, if you're interested in partnering with us so that we can bring a team to you, and that we can bring everything that's needed to you to pull down all of those access and participation barriers possible, we'll be glad to work with you. I would encourage you to contact particularly our nurse supervisor, and I'm going to switch over if I can get into the chat. Yeah, I think I can. I'm just going to include the name of our nurse supervisor, Carissa Shepard, and I'm going to include our phone number here at the health department, where any groups or agencies or organizations that are interested, there she is in the chat. So if you're interested at all in working to partner together for us to come to you and to your populations, we want to do that if that's going to increase access and participation for the people that you serve, and that also we are interested in serving as well. So the thing of concern that I want to talk about is I have been working in public health for 32 years. I've been actually at the helm of the Carter County Health Department and the Johnson County Health Department for 21 years or so. So it's been a minute. And in the time that I've been with public health, I have never seen a case of congenital syphilis. And right now in our region, we've got 4 cases of congenital syphilis. It's something that is just unheard of, that we've not seen before. And we know that when we talk about STIs, we are seeing the STIs that we see that we are seeing the effects of is just the tip of the iceberg. So for those 4 cases of congenital syphilis, that is truly just a very tip of the iceberg view of underneath the water, how large that problem could potentially be. So the health department is working on, we certainly are turning our focus to ways that we can help identify and make broader our screening process. All of our pregnancy tests that are positive pregnancy tests, we're just going to go ahead and screen for all those different things. This is something that the health department does free of charge. There are agency partners in the community who also do a great job with screening and providing treatment. But as you know, that screening and treatment can be extremely expensive. So that's where public health and the health department looks to fill that gap. We want to step into that gap, and where there are agencies that have to choose the best way to use their resources. So perhaps they only screen when, for example, there are symptoms reported. We can help fill that gap by doing a more broad across the board screenings, because some of that screening can be very, very expensive. With treatment, we can also follow through with that treatment that can be really expensive, which I know presents a barrier. So if you're hearing, as you're hearing this, if you're hearing, yeah, that's me, that's our agency, that does prohibit us from being able to broaden our screenings as much as we would like to. You know, those things do present challenges for us. Certainly that's one of the areas that we would like to partner. And we know, because of the situation we've got right now that we're facing, we know that we collectively are going to have to work together to broaden those screening and treatment services that do impact the entire community. And when I think about the long-term, lasting, lifetime impact that is going to be had on these babies, that is something that public health just really takes to heart and has been a real issue for us. It's just a real call to arms for us. And then that of course is it also can represent cases where the pregnancy is lost for those times when there may be an STD that is non-symptomatic. And that often is the case, that it's non-symptomatic, but it's there and the treatment isn't provided in time or at all. So that's just a concern, kind of a call to action that I wanted to make today. And at this point, I will either kick it back to Jillian for questions that anybody may have, or if there aren't any questions, kick it to Shauna to talk a little bit more about the health education piece and some of the promotive services that we provide. Thanks.
I'll give a pause just a second and see if anybody has any specific questions for Carolyn. My name is Shauna Johnson. I'm the health educator at the Carter County Health Department. So we'll wait just a second, see if anybody else has any questions. You can put them in the chat. You'll forgive me for not turning on my camera. I'm also taking the minutes, so I have several screens up while I'm also trying to present my information to you. So if you have any questions, go ahead and fire away for Carolyn specifically. Okay, I'll take that silence as a resounding no. And just to pick up where Carolyn left off, if you don't know me, which most of you do, we've worked together. My name is Shauna Johnson. I'm the health educator here at the Carter County Health Department. I've been here for almost 3 years. And like I said, many of you are familiar with me, and I just wanted to touch more on the community piece of our health department. Like I said, you all see me around and about in different locations and different events and different venues. And I just kind of wanted to circle back around and also talk about, again, what Carolyn touched on about how we've come to a realization that we can have this building and we can offer all of these services. That's great. But if our population, our community can't get to us for various reasons, barriers, transportation, we know they run the gamut. We want to try to turn that around and again, see if we can take those services to our populations and meet them where we are. That is the literal kind of overall resounding goal I think we all want for Carter County as a whole. So we're kind of reversing what we typically used to do before, and we're trying to take as many services as we can make mobile to our community instead of saying, hey, come here, we offer all of these wonderful things. So she kind of touched on some of the components that our nursing staff and our clerical staff, and you'll probably see me occasionally too, are trying to bring out into the community. Fluoride varnishes. We also have had nurses that go out with our chance social workers. So when they're doing home visits, they're able to offer that varnish to our community. And hey, we'll bring a nurse and you don't even have to leave the comfort of your home. If you've ever seen me at any events, anytime that typically I have somebody with me, it's usually both or one of our chant workers, Anna Poston and Becky Saturn. We all kind of roam around the Elizabethan and Carter County together and try to promote as much as we can on some of the bigger events that we do, just to kind of give you an idea of how much we try to reach out into the community since July of this year, up until I just finished out my reporting paperwork for December. Up until now, we've reached a total of, just with our community outreach, now this is our back to school bashes that we have for both the city and the county. Shout out to my coordinated school health partners, Jenny Jones and Emily Matthews in the city and county schools, because they kind of rope us in and include us, and we couldn't do it without them. But since then, we've reached a total of 4,007 people since July. And that's through various, like I said, big events like the back to school bashes, Sometimes we do fall promotion with our senior center during like their annual salt fair. I also do some programming in both school systems, depending on the need and the age of the students. It can be anything from hygiene, learn how to wash our hands and take care of ourselves and be clean and healthy, to nutrition education, social emotional health, bullying, cyberbullying. I do a lot of programming in the school system and kind of help out their social workers, so they're not overwhelmed. You've seen us at, like I said, all of the big events, those back to school bashes, the medical care boots of the flu events for the past 2 years that they were able to get up and going. We've also done several flu throughs now that we're past the dreaded C word of COVID. And so we set those up in both the county and the city. And like I said, that kind of follows along with that, take our services to our population and our community so that we can just break down some more of those additional barriers and try to offer as much help as humanly possible. Also want to thank my other community partners, the Elizabeth and Carter County Library. Everybody on this call knows how wonderful they are. UT Extension have been incredibly kind and gracious to me, and we do a lot of programming together. Jillian, of course, at Carter County Drug Prevention. I wouldn't be able to do half of my job without her help, and partnering with her and kind of linking together to see how we can help everybody. So thank you to all of those people as well. Like I said, the only reason I'm able to do my job is because my partners also extend that olive branch, and we kind of work together instead of working separately. We kind of combine our resources as needed. We do have some exciting things coming in the spring. I don't know if I want to say them just yet. We still have some talking and some planning to do, but we're looking to kind of rope in our faith-based communities too, so we can get them to have a seat at the table. It is Cervical Cancer Awareness Month. And I know that Carolyn touched on our Tennessee breast and cervical screening program that we offer. We do have a wonderful nurse here that does our Tennessee breast and cervical screening program, and it's housed out of Carter County. So if you do know someone who's uninsured, underinsured, over the age of 40, they can come in, they can call and make an appointment, and we can kind of get the ball rolling on that so they can get screened free of charge. Eligibility depends on a case-by-case basis, so I won't give a general overview. Just call if you know somebody that's interested, or you're interested in yourself, and then we can get you set up. I will put all of this information in the chat as soon as I get done speaking. Like I said, I am taking the minutes too, so I can't run the chat and also talk to you guys. So I will put some of these resources in the chat. I will also put my email in the chat again. I did when we initially started the meeting. I'll do it again. If I can come to you and present on a topic, I know that Jillian and I are looking forward to kind of kicking off mental health first aid in the county. I think Jennifer Street's on this call too. She's an instructor for adult mental health first aid, as well as I am. We can come and provide that training to your staff, to community members. I'm also going to get my youth mental health first aid certification in March, and then we'll be able to do those classes. I think Jennifer Street's also getting her youth instructor certification, and we'll be able to offer those classes free of charge. They won't have to pay for anything. Any of your attendees won't. We actually were able to do it through a giant grant through the Tennessee Department of Health, so we're able to provide those materials when a Tennessee Department of Health instructor co-teaches the class. So again, we can come to you. Mental health first aid is something I can teach in other counties. So if you have a location that's not in Carter County, I can go to another county. Other than that, I like to stay in my home county. So if I can come, if I can help you in any way, shape, or form, if you would like me to come talk, just get an overview, or even if you have a specific topic, there's a lot that I can do and help with. Like I said, I'll put my contact information in the chat, which most of you, I'm sure, pretty much have it, but we'll do it again. I think that's all that I have. Do you have any questions for me? Everybody's so quiet today. Okay, if you think of any questions later, pop them in the chat. You can email them to me. I'll be more than happy to answer them and to plan things with you. If you have any other questions, like I said, reach out to any of us and we'll be glad to answer them for you. Thank you so much.
And Shauna, you may want to stop sharing your screen.
Yep, I got you.
Thank you.
I was getting there all at once.
Thank you, Caroline and Shauna, for sharing. Any questions for them or anything else that y'all thought of that you didn't share before our speaker that you want to share before we move into our committees?
I will just say, this is Tony DeLucia, that both of those presenters were fabulous. The material was fabulous, and it raises so many questions about opportunities to link folks that aren't yet at the table. It was mentioned the faith community, for example, but I've been working with veterans. Now we're thinking about resilience. So you get into people who deal with environmental issues, of course, the economic issues and the Chamber of Commerce and folks like that. People who do everything with regard to the food system, food trucks, things like that. I mean, I didn't hear that mentioned, but it's got to be not only a public health issue, but it's an opportunity when we're trying to find jobs for people. And then, of course, just all of our assets. We used to do some built environment stuff. We walked on the Quincy Trail over by one of the elementary schools one time, and with I think there was an event going on. And it's just sad that we're not recruiting more people to make those sustainable. If they just come and go, then what kind of taste does that leave in your mouth? And so I don't know if you all would be amenable. Randy Byington and I have had this chat about trying to find ways that grant support can be obtained. It's only a bridge until the state wises up. But for example, we could talk later on about other substances and cancer. What's the relationship? Of course, we know about tobacco, but what about alcohol? What about some other things? I know y'all are speechless.
Thank you, Dr. DeLucia. All right, I'm going to ask each of our committee chairs to share a little bit about just about your committee for anybody who may want to join and what you might be working on today. So we do have 3 committees. Our committee A is our Substance Abuse and Mental Health Committee led by Tia Hughes. Our second committee is our Carter County-wide committee led by Gabby. And our third committee is our Community Assessment Committee led by Emily. So if each of y'all would share just a second about what your committee is and what you're going to be working on today, so folks know if they want to join you, that'd be great.
So in Committee A, all we're really discussing is different events that we've been a part of throughout the last month, and then different things coming up, and seeing if we need help putting those events on within the community.
In Committee B, we're continuing our conversation about food insecurity in Carter County and some things that we've got in our strategic plan to address that. And then we'll be talking about our second objective, which is addressing mental health in Carter County.
Emily couldn't be here, so she just asked me to fill in the group. We don't have anything new going on in the data committee outside of just trying to promote the data that we collected through the CHAW. And we'll be working in the coming months on putting together some kind of like brochures and infographics or kind of one-pagers about the CCC, what we do, and kind of like some key data points. So that will be coming up in the next few months. But our Committee C will not be meeting today. Just want to let everybody know.
Okay, well, I'm going to go ahead and open the rooms up for everybody. Again, you're welcome to join whichever room you want to join. And then when your committee is finished meeting, y'all are free to go, and we will see you next month.